Hey y'all, it's Dr. Sharon with Clinic Reviews. Today we're going to be talking about patient environment and restraints. The first 10 to 12 questions of the NCLEX are pretty much common sense questions, which is sometimes why they can be so frustrating because you think, I didn't study this. Yep, they know you didn't study it, or they know you haven't thought about it in a long time. They want to know if you can use your common sense. There's a lot of common sense in the patient environment questions. I'm going to tack some restraint questions on at the end to help you with those. So let's get started. Hello, Clinic Review family. Dr. Sharon with Clinic Reviews. Today we are going to be doing the Blue Book. Going through the Blue Book, I think it's page 28, something like that, patient environment. You can get the Blue Book on Amazon. It was written by the GOAT Mark Klimek, and it's basically a fact book, facts. It's a book of facts that you have to know. And what I do is I write questions to go along with it so that you can see how to take the information and use it. You can also get the Blue Book app, which is at clinicreviews.com. Clinic Reviews is a larger organization that also offers NCLEX reviews. You can go to clinicreviews.com if you're interested in that. So let's go ahead and get started. We are talking about patient environment. This is not rocket science, but there is a lot of common sense in this today. So a nurse is providing discharge instructions to a patient with chronic obstructive pulmonary disease who uses oxygen at home. Which statement by the patient indicates a need for further teaching? I will not allow anyone else to smoke in my house. I will take my oxygen off when I am smoking. I will use nicotine patches as recommended. I understand that smoking cessation is important for my lung health. All right, first of all, it says need for further teaching. So further, I always think further is false. F goes with F, so further teaching is false. So I'm looking for the false statement. They have COPD, but they also tell us he uses oxygen at home. So they tell you that for a reason, y'all. The information they give you in the NCLEX stem of the question usually is all important. A lot of people say, well, they're super vague questions. They're really short questions. They are, but the information in the question is important. So pay attention to it. So they didn't say he was on oxygen at home for no reason. So you can see there's some questions related to oxygen. I will not allow anyone else to smoke in my house. Well, that seems like a good idea, not just for the oxygen, but for the COPD. So when you've got oxygen at home, there's no smoking. When you have COPD, there really shouldn't be anybody smoking. So I like A. That seems like a good, true statement. I will take my oxygen off when I am smoking. Okay, well, I would rather they take it off than leave it on. However, what is the rule for smoking when there's oxygen in use? The rule for smoking is there's no smoking when oxygen is used. That's not a recommendation, that's a rule. So anything that says differently needs further teaching. Okay, we would need to say, no, there's no smoking. You don't just take your oxygen off. There's no smoking when oxygen is in use. I will use nicotine patches as recommended. That's fine. That's good. If they got to quit smoking, that's good. I understand that smoking cessation is important for my lung health. That's a true statement. That is important. So the one that requires further teaching is that I will take my oxygen off when I am smoking. The rule is there's no smoking when oxygen is in use. A nurse is educating a patient about maintaining an ideal home environment for respiratory health. What humidity level should the nurse recommend to prevent respiratory infections and promote comfort? Now, this is just a fact you have to know. And the recommendation is anywhere between 30 and 60%. So you might say, well, Sharon, C has 60% in it. Yes, but C goes up to 70%. If 30 to 60% is the right answer, B is the only one that falls within the entire area of the correct answer, right? So we don't want it to go up to 70%. We want it to be anywhere between 30, 31, 32, 33, 55, 56, 57, 58, 59, 60. But 61 is not okay. So that 30 to 50% is the best answer. A nurse is advising a patient with asthma on maintaining an ideal humidity level at home. What is the recommended humidity range to reduce asthma symptoms? Y'all, it's the same answer. Okay, so don't go, well, now it's a different scenario, so maybe it's a different level. No, it's not. 30 to 50%, 30 to 60%, 60%, not 61. 30 to 60% is the correct answer, whether they have diseases or don't have diseases. Okay, so don't let that confuse you. Which patient statement indicates understanding of the contraindications for smoking when using oxygen therapy at home? I can smoke in another room from where my oxygen is stored. I can smoke with my oxygen as long as the windows are open. I should smoke only when I'm outside. I should not smoke while using my oxygen. Okay. Which patient statement indicates understanding? So we're looking for the true statement. So is it true that I can smoke in another room where my oxygen is stored? No, there's no smoking when oxygen is used. So A is false. I can smoke with my oxygen as long as the windows are open. No, there's no smoking when oxygen is used. I should smoke only when I am outside. Well, no, there's no smoking when oxygen is in use. I should not smoke while using my oxygen. Yes, that's correct. I should not smoke while using my oxygen. Now, don't say, but it doesn't say I should not smoke when oxygen is in use. Y'all, all the other answers are false. So we have to say D is as close to true as what we're going to find. A lot of people say, well, I memorized there's no smoking when oxygen is used, and that's not what D says. So I better pick one of the other answers. Y'all, don't do that. What you say is, I know the rule. The rule is there's no smoking when oxygen is in use. And I'm going to pick the answer that most closely comes or represents the concept that I know to be true. D comes closest to the concept that I know to be true. And so I'm going to pick D. What is the most important step a nurse should take to prevent infection when cleaning a room between patients? Using a standard household cleaner, opening the windows to air out the room, using a disinfectant approved by the hospital, or sterilizing pillows between patient use. What is the most important step a nurse should take to prevent infection when cleaning a room between patients? So if you don't know this, disinfecting surfaces. So when I was a new grad, there were 3 components of standard precautions: wash your hands, barriers with body fluids, and disposable supplies. Okay, those were the 3 components of standard precautions when I was a new grad. I don't know when it was. I started noticing it about 10 years ago. They started putting these wipes in all the rooms, and that's because they added something to standard precautions. Now the standard precautions are wash your hands, barriers with body fluids, disposable supplies, and disinfecting surfaces. So disinfecting surfaces. So you have to disinfect between patient use. Okay. It doesn't say sterilize. It says disinfect. So a standard household cleaner might disinfect, but there's a better answer. Using a disinfectant approved by the hospital is a better answer. So don't choose sterilizing pillows between patient use. We don't have to sterilize anything. We have to disinfect between patients, and we have to disinfect surfaces. So that includes disinfecting the bed, disinfecting the blood pressure cuffs, disinfecting the walls, the toilets, all that kind of stuff. There's no we can't sterilize the room. We can sterilize the room. We sterilize different things in various scenarios, but we don't sterilize patient rooms. A patient in the intensive care unit is crying, restless, and agitated. Which is the best nursing intervention? Turn off unnecessary alarms and dim the lights, increase the volume on the television, reduce frequency of vital sign measurement, provide patient education. All right, they're crying, restless, and agitated. I don't know why they are crying, restless, and agitated, but they're in the intensive care. It doesn't say they're confused. So this is a very vague question, very, very vague. Okay. But I do know that there's a lot of stuff going on in the intensive care unit. There's a lot of alarms. There's a lot of lights that are on. There's all kinds of stuff going on. So if someone, and the question is crying, restlessness, and agitation, is that a symptom of like overstimulation by the lights, right? And so I have to say, well, it could be. I mean, it could be. So let me look at it. The answers seem to reflect that. Turn off unnecessary alarms and dim the lights. That seems like a good idea. That seems like that could help. Increase the volume on the television. I don't like that answer. Increase the volume on the television. I can't imagine if they're crying, restless, and agitated that increasing the volume on the television would help. I don't like that answer. Reduce frequency of vital sign measurement. Well, that might help, right? That's less stimulation. Provide patient education. I mean, if they're crying and restless and agitated, I don't see how they're not in a place to learn anything. That's not the right mindset for learning. So I don't like D. So I want to try to reduce their restlessness and their agitation and their crying. So would it be better to turn off unnecessary alarms and dim the lights, or to reduce the frequency of vital sign measurement? Both of those things reduce stimulation. So what I'm going to have to do is I'm going to have to say, well, I'm going to do one, but I'm not going to do the other one. And that's going to help me get a better idea. So they're in the intensive care. So I'm going to turn off unnecessary alarms and dim the lights, but I'm not going to reduce frequency of vital sign measurement. Or I'm going to reduce frequency of vital sign measurement, but I'm not going to turn off unnecessary alarms and dim the lights, which means I'm reducing vital sign measurement, but all the lights are still going to be on. All the alarms are still going to be going off. That doesn't make much sense. Like, they're in the ICU. I don't know that it's safe to reduce vital sign measurement in the ICU, but it would be safe to turn off unnecessary alarms and dim the lights. So that makes more sense to me. And this is a really good example of a common sense question that you could get related to patient environment. And you have to know how to answer it. It's a best question. You can only do one thing. It's not a first question, y'all. It's a best question. So I have to say to myself, well, what's best for these symptoms? And it's very vague symptoms. Which of the following patients admitted for inpatient care should have the side rails up? Select all that apply. And don't say, well, everybody has to have their side rails up. That is not true. Everyone does not have to have their side rails up. Y'all, just because someone is sick doesn't mean they have to have their side rails up. So like, if you were to, you might put the side rails up on everybody's bed, right? You're like, well, we do that for everybody. Fine. But have you ever had a patient who's like, can you put my side rail down? Let's say you did. Maybe you never have, but let's say you did. Can you put my side rail down? Who would you say, no, I really can't. I need to leave these side rails up? Because there's a lot of patients I would say, yeah, sure. I want you to call if you need help getting out of bed, or if you have to go to the bathroom, please put your call light on. Yeah, I'll do that. Okay, but I can still put the side rails down if that's what they want. So what we're saying is, if someone says to you, can you put my side rails down? Who would you say, no, that's not a good idea? A 92-year-old admitted with pneumonia. All right, is pneumonia the reason I'd put the side rails up? No. What would be the reason I would put the side rails up? Her age, y'all. So elderly people should have side rails up. It helps them move around in bed. It helps prevent them from falling out of bed and so forth. So her age puts her at risk for falls. So I'm not talking about all 4 side rails, y'all. I'm just talking about 2 or 3 side rails, but I would want to put 2 or 3. I wouldn't want to put them down for a 92-year-old. An 18-month-old admitted with asthma. Okay, the asthma doesn't make them at risk to falls, but the 18-month-old does. Y'all, if they're an 18-month-old in the hospital, they could be climbing around. They could be climbing out of bed. I don't know how well they can walk and so forth. So a young child, not like a 5-year-old necessarily, but a young child should have their side rails up. A 17-year-old admitted with fever of unknown origin. Is there anything here that puts them at risk for falls? And don't say, well, they could have an IV. They could have an IV, but it doesn't say they do. You only know what they tell you. Is there anything here that tells us they're at risk to fall? No, there's not. Their age doesn't put them at risk to fall. Their diagnosis, fever of unknown origin, doesn't put them at risk to fall. So if they said, can you put my side rails down? I would say, yes, I can. A 54-year-old admitted with a UTI and acute confusion. So if he said, can you put my side rails down? What would I say? I'd say, no, you've been kind of confused on and off, and I really don't want to put the side rails down. It's his confusion. So confused patients should not have their side rails put down. A 6-month-old infant with failure to thrive. Y'all, they're 6-month-old. Of course, we're going to put the side rails up. We do that even at home, whether in the hospital or not, right? We put them in a crib. Of course, their side rails are going to be up. A 34-year-old patient with acute renal failure. What puts them at risk to fall? And don't say, well, they could have this. They could have anything, but we only know what they're telling us. Their age doesn't put them at risk to fall, and the diagnosis in and of itself does not put them at risk to fall. So the correct answers are A, B, D, and E. Again, another common sense question that you could get related to patient environment. A nurse is considering the use of restraints for a patient who is at risk of falling out of bed. Which of the following is the most appropriate initial intervention? All right, if they're at risk to fall out of bed, I'm thinking about restraints. Okay, apply wrist restraints to prevent falls, administer a sedative to keep the patient calm, apply a vest restraint to keep the patient in bed, or use a bed alarm to alert staff if the patient attempts to get out of bed. So we're always supposed to use the least restrictive method first, and we're supposed to be able to identify what we used first. And so the bed alarm is less restrictive than wrist restraints or vest restraints. Sedative is a restraint. So the bed alarm is not a restraint. So I'm going to use the non-restraint before I use any of the restraints, because A, B, and C are all restraints. Next question. How often should a nurse assess a patient who's been placed in restraints to ensure their safety and well-being? Every 15 minutes, every 2 hours, every 4 hours, or once per shift. So here's the rule, y'all. You have to check on them for their safety every 15 minutes, 10 to 15 minutes. If it's at 10, I would have picked that. They're not going to make you choose between 10 and 15. You have to check on them every 10 to 15 minutes. You have to release their restraints every 2 hours. So that's why a lot of hospitals just choose to have a sitter in the room when somebody is in restraints. Sometimes they'll have those video cameras that somebody's monitoring all the time to monitor them, because most places, unless they're in the ICU, out on the floor, it's hard to get somebody in there every 15 minutes to check on them. So they do have to be checked on every 10 to 15, and they have to be released every 2. When applying restraints against a client's wishes, the nurse may be guilty of which of the following: malpractice, violating confidentiality, false imprisonment, or negligence. Correct answer is false imprisonment. Do not apply restraints just because it's more convenient for you, especially if you haven't tried anything else. Y'all, patients can have a legitimate reason to file false imprisonment charges if they are restrained against their will without proper documentation of why there was a medical reason that they had to be restrained. Okay. So don't ever restrain a patient just because it's more convenient for you, or maybe because if they pull their IV out, find out if they have to have their IV. Where else can we put their IV? Can we hide their IV? Can we wrap it up? What can we do to prevent them from pulling it out before we restrain patients? So restraint should always be the last possible reason or possible intervention that we use. When caring for a client who's in restraints, which of the following documentation must be completed? Justification for the restraints, monitoring every 30 minutes, the patient's family history, type of the restraint, time restraint is placed, the patient's dietary preferences, or release restraints every 2 hours. So what do we have to document? Well, we do have to document the justification for the restraints. Monitoring every 30. Okay, here's why I did this, because it's monitoring every 15. So don't pick it. If it's not monitoring every 15, don't pick every 30. Okay. That's 15 is the right answer, not 30. So we can't pick B. Patient's family history. No, we don't have to document that. Type of restraint. Yes. We have to say the type of restraint we used. The time restraint is placed. Yes, because we can only leave it on with a doctor's order for 24 hours. And we have to get the order. All that has to be documented again after 24 hours. Again, why are we still using the restraint? We have to get another doctor's order, all that kind of thing. Okay, so the time is placed. The patient's dietary preferences, no, that has nothing to do with it. Release it every 2 hours. Yes, we have to release it every 2 hours. So the correct answers are A, D, E, and G. B would have been correct if it had said monitoring every 15 minutes. All righty, that is the end. I hope you found that helpful, patient environment and restraints. And if you're interested in any of the services you can pay for at Clinic Reviews, we do an amazing NCLEX review on demand. You can go to clinicreviews.com for that. We also do small group tutoring. If you pay a monthly fee, you get 4 tutorings. They're each about 3 hours long. And Mark Klimek does 2 of them. I do 1 of them, and Pete Savard does 1 of them. And then we also have a streaming service that you can pay for that's only $19 a month or something like that. All right. Well, I hope you have a great rest of your day. Good luck on your NCLEX. I'll see you later.